I will restart in this point. Then this is the first ring produced in PMMA without sulcus. Okay, you have idents and one ident above and one ident behind. And then because this, you have only 4.4 millimeters in high. The second one in the market, the number one in this point is the BX for my friend Suvan, but in compare with iRing, Oasis, Morsher, Maliugin, you have 0.7 to 0.9 millimeters. Here you can see how the ring engage in the iris like a wave. There is no sulcus in this ring. The sound now is good. My sound?
Yes, yes.
Oh, perfect. Okay, I like to call my ring to challenge ring because the learning curve to this ring is not easy. It's challenge to start this learning curve. But when you have the learning curve finished, you can do a lot of challenge case, as I can show you here. Patient with so teeny small pupil, and you can see this patient is a small a very shallow anterior chamber. Then you can connect first the small one ident and use like to stretching the iris, and then you connect the second and the third small one, and finally you connect the hooks to give the stability. Here, another case that you can see, connect is the same way, the small indent behind in the center, and the second and the one, and the third one, and you can see how the bigger one goes above the iris to give stability, and the final two hooks give the final stability. In this patient, I perform Yaman technique, but why, Sergio, you don't did the Canabrava technique, your technique in this kind of patient? Because in patient with small people, I suggest to use Yaman technique because you can insert the IOL inside the eye. Then I have some tips, some hints here. I like to do one flange in one side first. And again, I use a microforceps to hold the haptic, and then I remove the insulin needle. Then you can see, and now I will remove the bag, and then I remove the ring from the eye. I use a simple McPherson forceps. I disengage it from the iris and remove a simple McPherson forceps. Then a patient, a flex, because this ring, you connect the same way. And then I go with the patient. In my hospital, I have a Johnson & Johnson Catalyst, and you can see the ring stays stable inside the eye because it has 0.4 millimeter high. Then this is you can introduce it in the 0.4 millimeter incision. Then I back to the operating room, and I like to insert first a capsule tension ring. And after to insert, I like it because when I insert the capsule tension ring before, you can stabilize it, your bag. And after to do the fake emulsification, insert a 3-piece IOL, I remove the ring from the eye using a simple McPherson forceps. And then I finish the surgery. Fixate the iris using a simple knot, as you can see. And then it is finished. Then here, another catalyst report, Johnson & Johnson, to see another patient that you can see how the ring stays stable in the anterior chamber during the fake emulsification. And here is the ring. Today it's available in all South America, and the Europe CA mark is coming to go around the road. Then thank you again for the invitation. For me, it's an honor all time to invite me to talk to India. Thank you.